Okay, so the last injection in this procedure is going to be injecting into the medial retropatellar space. It's going to be in plane, going medial to lateral, right to left. Touch the patient, ask them, does that feel sharp? Okay, nothing significant. So now we're going to puncture. The needle is going to advance from right to left. You may have to level out, go kind of shallow as you approach the patella.
Strong Dads wants to thank Quality Automart and Service for being a proud sponsor of the Strong Dads podcast. Started in 1985 and going strong for all these years. Recently, Quality Automart has transitioned from owners of Mark and Nancy Repke to longtime employee Fred and Lorraine Venus. For all your automotive needs and golf cart needs, check out Quality Automart, located across from Indian Lakes on Highway 46 outside of Batesville, Indiana.
Tell me about the right knee. What's the problem?
Back in October, I was doing banded exercises, so I had band on my knee and went to do the exercise, went to get down on the floor without taking it off, and had like intense pain in my knee in here. Couldn't get comfortable for about 15 minutes. Came in here right after that. It was about 2 hours later, I saw Dr. Tinbarge. He's like, I don't think you tore anything, but definitely made him mad.
Yeah.
And it's still irritated.
So since October, it's still been painful.
Simple act of squatting down in a chair and standing up for a while irritated it.
Okay. It's mainly like you're on the inside, the medial side?
Right in here.
All right. We'll see what the ultrasound images show, so we may alter your exercise routine a little bit. So did they explain to you at all about what I do and what we're going to do here?
Leg did a little bit. He handed me the pamphlet on the PRP, and it had some of the information in it. Yeah. But so he said you're really good at.
Yeah, we're going to do a diagnostic exam with the ultrasound, and diagnostic ultrasound is able to actually see more soft tissue characterization than MRI. And obviously, you don't see it on X-ray. Right. The other nice thing about the ultrasound is we get to do dynamic studies where we can stress the joint space or stress a ligament or tendon to see just how bad the problem may be. So the real-time dynamic imaging is very helpful. And if need be, sometimes I do comparative imaging from side to side just to compare apples to apples. Okay. So we'll just get started with the exam, and then when we get done, I'll tell you what we have.
Cool.
Okay. So this is where we started off on the exam. This is on this side of the image. This is going towards your hip. This is going towards your foot. Okay. So this is your femur. That's your kneecap, the patella. Okay. And essentially a normal view there. I tried to find some fluid in the area, but there's not. A lot of doctors inject into this area without ultrasound guidance as one of their primary sites to inject into the knee, but it's really kind of a waste of time because when it's full of synovial tissue in that area, then whatever they inject doesn't get down into the joint.
Doesn't go where it needs to go.
No. So now this is the infrapatellar region down here. Again, this is towards your hip. This is towards your foot. This is the patellar tendon. This is the femur. And you can see the cartilage on the femur right here, that black interface. Mm-hmm. But all of this is called the infrapatellar fat pad. Okay. And you can see how it's kind of dark and like kind of big, like circular areas within the fat pad. That's, very common fat pad edema. And the fat pad here in the knee is not just a cushion. Okay. It supplies nutrients to the knee joint, one of which is cartilage cells, chondrocytes. Okay. Yeah. So my little mantra when I treat knees is healthy fat pad, healthy knee. Okay. So we always make sure that we treat the fat pad. And then this is when we flex your knee. Okay. This is the outside, the lateral side. This is the medial side. The white line is the bone. Okay. The dark interface is the hyaline cartilage. Okay. Now, normal hyaline cartilage should be completely black or anechoic on the ultrasound.
Okay.
Hyaline cartilage is 80% water. So when it becomes somewhat degenerative or mainly dehydrated, then it can give you the kind of like joint crepitus or grinding type of sensation. But it's mainly because it's not that the cartilage is gone, it's just that it's gotten kind of rough. And so with our treatment, we're able to we don't really regrow cartilage, but we can resurface it.
Okay.
So if you look at the thickness of the cartilage right here on the lateral side versus the medial side. So we have a little bit more degenerative changes of the cartilage on the medial facet. So we would inject right along that medial facet of the trochlear sulcus, it's called. We would inject there. And well, another nice thing about this too is you don't have a large, lots of times there's a large bone spur that's typically seen at the medial peak. You do not have one. These next two views are the femoral condyle. This is medial, again, bone and then a little bit thin layer of the cartilage. And we would probably inject right along the margin of the femoral condyle. This is the lateral femoral condyle. There's that little bump with a small bone spur. Okay. Sometimes when the bone spurs are not that big, then at the time of treatment, I can actually use my needle to kind of chip them away. Okay. And then, but then you follow it up with the PRP, and then I don't have another. The bone doesn't regrow with another spur or a callus. What we do is a comprehensive but targeted treatment plan. Okay. You know that's how we get our long-term results. Okay. You know? So with what I'm seeing with your knee, you know, if as far as treatment goes, you know, I think I would want to go with. I have two different PRP products that I use. Okay. One is it's a 60 cc blood draw, and the platelet concentration for that is approximately 8x concentration. Like when you cut yourself and you kind of start to clot up and scab, the platelets are at a 1x concentration. So that PRP product has an 8x concentration. The other one that I can use for you has a 28x concentration. And so with a weight-bearing joint like this, that would probably be the best thing to do for you. Plus, that gives me more volume of PRP to inject for you. Okay. You know, so I can just basically cover all the sites adequately.
One treatment?
Now, it probably need to be two.
Okay.
Two treatments, because the platelets are active for approximately like 6 to 8 weeks, you know, and then they taper off. And so we need to do another treatment to keep that healing process going to give you the long-lasting response. Okay.
Okay, so the last injection in this procedure is going to be injected into the medial retropatellar space. It's going to be in plane, going medial to lateral, right to left. Touch the patient, ask them, does that feel sharp? Okay, nothing significant. So now we're going to puncture. The needle is going to advance from right to left. You may have to level out, go kind of shallow as you approach the patella. Now we're right there. You have to advance the needle all the way to the patella and try to get the needle tips that disappear under the patella, so you can, as you do the injection, you watch it flow in. And there's pressure with this. Now I'm advancing. I've put in already about a cc and a half here. What you don't see on this image is any backflow of the PRP going back to the right side of this image. That's because it's all going down underneath the patella into the joint space, and there's no resistance. So that's why I say that this injection is the most effective way to inject biocellular products intra-articularly into the knee joint, because it bathes all of the articular surfaces extremely well. We already specifically targeted the medial trochlear facet, which is another very specific targeting of a articular surface. And all of these things come into play with getting the best response for the patient using PRP or a biocellular product. It's a comprehensive, targeted protocol that is very likely, you can be very confident in knowing you're going to get a good response for the patient.
All right. Well, welcome to Strong Dads. I am here with Dr. Randy Moore. Randy, I want to thank you for giving us an opportunity to come in and see some of your work today.
Sure.
It was really pretty cool. I'm kind of a nerd geek, so I really enjoy looking at ultrasounds and working with people in that way. And so I just appreciate that you gave us the opportunity to come in and do that kind of thing. So if you haven't already, go back and watch the first part. Randy, basically you're diagnosing a knee, a lady's knee that she torqued it, I guess.
She was actually doing exercises. I guess it was prescribed to her maybe by a physical therapist or somebody. It was do some therapeutic bands, and she was just trying to do that exercise. It sounded to me like a lateral movement, but she got this really intense pain in the medial compartment. It's been there for a while.
Yeah. So before we go too much deeper into our conversation, give me a little history of what you do, your title and your profession and all of that, just so people kind of know like where your hands are every day.
Yeah. Well, my formal training was as a chiropractor, and then about 30 years ago, it was quite. I think it was a definite like dropping in your life by the Holy Spirit. I'd never even thought about diagnostic ultrasound prior to that. And I just
30 years ago it was pretty rare, wasn't it?
Yeah, nobody was doing it. But I read a little article about diagnostic ultrasound and using it to look at the spine actually, and it just lit me up. And so I immediately started investigating it, and so I've been doing the diagnostic imaging for right about 30 years, and been instrumental in developing a lot of the like standardized imaging protocols that are out there today. And then about the last 10 or 12 years, I've gotten involved with doing the regenerative medicine with ultrasound guided injections with like what we do here with platelet-rich plasma. There are other biocellular regenerative products that can be used to help people.
Yeah.
But we do the platelet-rich plasma here.
So a lot of the work that we saw today, that whole idea of ultrasound guided work. Before it was ultrasound would be used to make a diagnosis, right? Or to see a baby or to see something wrong or whatever.
Right.
But now you're hearing people using ultrasound to locate a joint or whatever, and then actually locate an injection or something right in through those specific tissues. And so we're going to actually put some clips of that in, and so you guys can see the needle actually going in. I, in particular, had this process done by you, and I got the biggest kick out of watching that needle through my knee. It wasn't always a little painful here and there, but it was really interesting just to see that. But if that's 30 years ago, you're starting, and then you start to understand the whole imaging process more. Who trained you up, or did you have to do a lot of self-training? Because nobody was doing the guided imagery stuff. They were just using it for diagnostics.
Correct. Well, even learning the diagnostic imaging, I was pretty much self-taught, because there was, back then I found one textbook that somebody was beginning to do some work on ultrasound imaging of the shoulder. And then other than that, there really wasn't anything out there. So it just started like just knowing the anatomy and putting the probe on there and figuring it out what you got, And then the ultrasound guided injections that came with the regenerative medicine, that actually ultrasound guided injections initially started out with teaching medical doctors just how to do guided steroid injections into a joint. But then the regenerative medicine is much more intricate in that, because we treat the joint, but then we also have these specific targets, like you referred to there. Like we can actually inject into a meniscus. We can see a specific site within the ligament that needs to be treated. So that's all came from just not trial and error, but with your ability to image, then that greatly enhances your accuracy of the injections.
Well, I think that kind of gets to a point of, I've had injections, steroid injections and things like that, where I'll just say they were pretty general. One shot, into the knee, and I guess it goes to where it's supposed to go, right?
Yeah.
Whereas the guided work, you actually go and you say, see this tendon right here? I'm going right to or in that tendon.
Exactly.
And you can inject, you can actually see the fluid inject in. So it's very specific. What's the benefit? I mean, I can assume the benefit, but what can I expect the better result to be from not just bathing everything, but going right to the pinpoint?
Well, the benefit is that when you place the PRP very specifically, then there's a cellular communication. Like when a tissue is sick or injured, then it's sending out signals that I'm not healthy and I need help. And so by specifically placing those platelets right there, then they don't have to migrate anywhere. They get to work right away. And so you have a high concentration of platelets, say you're injecting anyway, but then they accumulate and they stay right there at that site.
Right.
Yeah.
So we're using PRP, or platelets is the word we're using. Mm-hmm. How does that differ from stem cell? Because I hear that word used a lot as well.
Exactly, yeah. So the platelet-rich plasma is a very, very high, good platelet-rich plasma, high-density platelet-rich plasma is a high concentration of the growth factors, the platelets in your blood. So like when you cut yourself and it begins to clot up and scab, then those are the platelets, the growth factors in the platelets that are healing that. And so the platelets, and they are simply growth factors. They're basically designated to do, like one thing, like where you put them, they're going to heal that structure. A true stem cell is considered to be an undesignated cell. So it's a cell that has the potential to remodel into various types of tissue.
Bone, muscle, tendon, ligament, whatever. Yeah, okay.
Yeah. So, and you have to be careful about that as far as like where as people say they're marketing stem cells, third party, or the medical term is NonAutologous stem cells that they're marketing. They are typically not those highly potentiated stem cells, true stem cells. There's actually more growth factors.
Okay.
That's in those.
Yeah, so there's more something to stimulate growth versus actually a cell that will grow into other cells of that type that we're looking for.
Exactly.
All right. Okay. Is there a significant success rate difference, or does it depend on where you're going to use it and for what benefit?
There's a different response. There's a different success rate. Yes, depending on the case and the status of the area that we're treating. Sometimes a true stem cell product would be the best way to go for somebody. But with the advancements of platelet-rich plasma, what's happened in the last few years is that we're beginning to find ways to concentrate more and more of the platelets in the blood that we extract.
Okay.
So we can actually really optimize the acquisition of those platelets, and then so we can get a stem cell like response from that. No, I'm not saying that we shouldn't use stem cell products, but
well, they're more expensive. I know that.
Yes.
So that's definitely one of the drawbacks.
Right.
Is the expense part.
Mm-hmm.
Do you do both?
Yeah.
You do stem cells, so you do both, but more PRP and
Yeah.
Okay.
Yeah.
So Randy, I'm not being mean, but you're a nerd like I am about this stuff.
Yeah. Yeah.
Which is really cool, and that leads me a little bit to the idea of. You said God kind of dropped this, the Holy Spirit dropped this kind of thing into your life of opportunity here. Mm-hmm. We're doing Strong Dads doing real life. And part of what we do here is try to have a conversation about what God has to do with what we do in our life. Mm-hmm. Right. And so we can nerd out all day long on really cool stuff like this. But at the end of the day, something had to be planted in you. Mm-hmm. Tell me what God has to do with the journey you've been on and how you've known that, like how versus, I don't know, it just happened.
Somewhat in retrospect, like I said, the very first time that diagnostic ultrasound crossed my mind, I was in my office, and it was on a Saturday morning, and I had some patients that didn't show up. They didn't keep their appointments, had a break in the patient flow. And so I picked up this journal. I was reading through it, and I came across this very small little sidebar article about another doctor using ultrasound to look at the muscles in the spine. And it just, at that time, it completely excited me. But then in retrospect, as I've gone through my career with this, it's like it was a complete departure of what I could have never planned this. I would have never been able to orchestrate this myself. And so just the idea of delving into the ultrasound, and then my career path of what I've done over the last 30 years of, just teaching at universities, and then some of the cases and the procedures that I've done for people that I know in those particular instances were like, I just know that I feel God's presence and like showing me like, this is what you need to do. Like there's been some cases where like it was completely, a Holy Spirit guided procedure, because I've been working in other doctors' offices, and like in one case I had a guy that came in that had been diagnosed with cardiac problems and been diagnosed with heart attacks, and this was all post auto accident where he crushed his chest against the steering wheel. And all the cardiac studies were negative, and he wasn't getting any better. And so I imaged him with the ultrasound, and very detailed type of imaging in the chest, obviously. But I found this particular site of an adhesion and some scar tissue right under his ribs on top of his heart. And I put a needle there.
Oh, wow.
But he got better.
Yeah.
And so that was one of the instances where I walked out of the room and I was like, that was not me.
Yeah.
I mean, God just used me, because I just, it was one of those moments where you just know.
Yeah. I want to piggyback on that for just a second, because I think a lot of us try to wonder and figure out, like, what am I designed to do? What is my purpose? Especially when we're in our earlier days of 20s and 30s when we're searching. And then you kind of get these things that get dropped in your lap, or you get an interest in. And for me, it's been a lot of the coaching and counseling. And Linda and I, my wife, we talk all the time about how we are in the middle of coaching maybe a couple or an individual, and usually marriage and family type stuff. Mm-hmm. And I'm in the middle of a situation, and in my mind, there's one side of my mind going, I don't have a clue where this should go right now, mm-hmm. because emotions or complications or whatever. And I do a prayer, like right there, Lord, you got to guide me right now, because these people need it and I don't know where to go. Mm-hmm. And without fail, like, stuff comes. Right. And I come out of those sessions and I go, that was not of me. I don't know where that came from. Yeah. And it's not to be haphazard about that and saying that. It's to say, wow, I didn't see that coming. Yeah. And to give the credit to him, just as you are right now. Like, well, I mean, you know your stuff about coaching and counseling and things like that. You've done your study and things like right. that. So you have that foundation, that basis, and I know my stuff. And they say that to become an expert, you put in your 10,000 hours. Right. So right. I think you and I are both old enough to say we put in our 10,000 hours. But beyond that, it's like there are these in the moment kind of like inspirations, or just like these ideas that pop in, that come into your head. It's like that's the blend of your personal work and expertise, and also being humble and wanting to, I guess, listen to the Holy Spirit and do your work. And that's a completely different level of job satisfaction. Yeah. Yeah. I mean, it really is. Yeah, and to maintain the humility to mm-hmm. say, that was not of me, mm-hmm. but I want more of it wherever the right. Spirit keeps moving. So that's pretty cool stuff. And I bring that up because I think there's a lot of guys that are listening and watching us right now that maybe they're in their 20s or 30s or even 40s and going, gosh, am I doing what I meant to do? And I don't know the answer to all those, right? Like, I can't just look at a guy and say, you should be doing this. I don't know. But inviting the Holy Spirit in is a great place to start.
It is. And, I think to add to that, what I would say is, like, for guys that are in their 20s and 30s trying to figure out if they're really doing what they should be doing with their life, do what you have right in front of you right now, and do it with all your heart. And whatever opportunities God has for you upstream, He's already got them planned, and they'll come.
Yeah. It's good stuff. Yeah. It's good. All right. We're going to go into one other chapter.
Okay.
We did the work chapter. You're a dad.
Mm-hmm.
You're a husband.
Mm-hmm.
All right. How does being a strong dad play into that part of your life? A lot of us get buried in our work. A lot of us are defined by our work, identified by our work. But there's a huge component to your life that's outside of this workplace.
Correct.
And probably when your kiddos were 5 years old, they didn't really care whether you did cool stuff or not. Right.
Right.
And so what does your faith have to do with being a husband and being a dad?
Well, I mean, my faith is being a husband and a father is that God set it all up. I mean, the parameters, the rules of how to have a good marriage are laid out there for us. It's just if we want to do it, we want to follow those recommendations and those rules or the statutes that God set up. And honestly, Marilyn, so it's like I want to be like, I love what I'm doing, I want to be a good husband and a good father, because I'm very concerned about my legacy. Like I want, and so being a strong dad is like, I want to be able, when I'm gone, I want my kids to say, my dad he's a pretty cool guy.
Yeah.
So by living a life for God is going to make that happen. And they see that.
Yeah.
So.
Yeah. They start to define cool in a very natural way. They don't say my dad's cool because he's got a really neat truck.
No. Yeah.
They say my dad's cool because I connected with him. He connected with me. He's there for me.
Right.
I enjoy his time. He's approachable. And these are the things that...
Well, my kids are a little bit older now, but for one of the blessings that I really enjoy is that they'll seek me out for advice.
Man,
to come to me. And I don't try to. Kids get older, like you don't want to overstep your bounds,
right.
But they come and ask me. So that tells me I guess I've done something right.
I can't tell you, for any of you young dads out there, and you're kind of wondering. What kind of relationship do you want? That's been the most rewarding thing for me. When they're young, you guide them. When they get to those teenage years, you say, well, you're going to start making mistakes, and you got to let them fall, right? You got to let them fall to their face and get up and encourage them, discipline them appropriately. But the idea that you have a relationship with them, and then all of a sudden they're in their 25, 35, 40s, and they're calling you to run an idea by you. That has been one of the most rewarding things for me as a dad. I have some older kiddos as well, and I get off those phone calls and I'm about ready to cry.
Yeah,
because you're like,
yeah. Those are very heart touching moments. It's like for your kids to come back and have enough love and respect, and just to see you as somebody that's reliable and somebody that they can. Seek advice from.
Yeah.
That's a wonderful thing.
Yeah. You got any closing words for any of those young, strong dads, or even old, strong dads? We got some oldies out there still getting it done. So any closing words for these guys?
I don't know. I think I just said it earlier. Just do what's right in front of you and do it with all your heart. Just do the next right thing.
Yeah.
Just keep going.
Yeah. Good stuff. Yeah.
Yeah.
Randy, I want to thank you for your time. I want to thank you for letting us come into your personal workspace and your client there. That was just super gracious for us to even be part of that. That's really neat. So we want to thank you. And probably sooner than later, it's going to be my knees back up on that screen.
All
so
right.
Thank you very much.
Okay.
Right. Yeah.
You bet.
Casey's is a premier garden center and gift shop located in Lawrenceburg, Indiana. Casey's offers a wide selection of plants, landscaping materials, home and garden decor, and gifts for every occasion. Casey's is committed to providing exceptional service, a unique shopping experience, and value to every customer. Stop in and see what makes Casey's so unique. Located at 21481 State Line Road, Lawrenceburg, Indiana, or call 812-537-3800. Let Casey's help you add beauty to your home.